The next topic we will be dealing with is infection. So infection, it indicates a host interaction with the organism. Most of the time infection happens when any pathogen enters inside the body. Okay, so the definition of infection is invasion of the body by a pathogen. So here the pathogen will be usually the microorganism that will invade the body. So once the microorganism invades the body, it will result in certain signs and symptoms. So that is referred as infection. And infection is divided into mainly two categories. We have got other types of infection which we will be seeing in the later slides. But most of the time infection is categorized into two types. First one is localized infection and next one is systemic infection. Now localized infection means it originates in only particular organ or one small area of the body. Okay, localized infection means it is occurring in one small portion of the organ. For example, if you have got an abscess in the finger or sprain in the ankle, so that can be referred as localized infection. Systemic infection means it is widespread all over the body. Okay, so it is affecting throughout your body, that is referred as systemic infection. For example, when you are having any infection in the blood, okay, bloodstream, what happens? It is spreading throughout your body. So that is referred as systemic infection. Next, moving on to causes of infection. Most of the time, infection is caused or occurred because of infectious materials like microorganisms. Most of the time, it can be from bacteria, virus, fungi, protozoa, or even certain parasites. Now, bacterial infection, in the sense, it is caused by the bacteria. For example, your E. coli, Staphylococcus, Streptococcus, then leprosy most of the time is caused by Mycobacterium leprae, then salmonella, then tuberculosis which is caused by Mycobacterium tuberculi, or syphilis which is caused by Treponema pelagium. All these are the examples of bacterial infection. Next one, moving on to virus. Now virus is also responsible for infections. Okay, so it can result in viral infections. For example, viruses example include your measles virus, rubella, chickenpox virus. All these are examples of viruses. Next is fungi. Now, most of the time, candidiasis or aspergillosis, all these will be the examples of fungi. Then protozoal infections. Now, protozoal infections example is your malaria, then giardiasis, toxoplasmosis. All these are examples of protozoa. And parasites, we are aware, all these roundworms, tapeworms, hookworms, all these can also result in infection. So microorganisms, mostly bacteria, virus, fungi, protozoa, and even parasites can result in infection. Next is development of infection. Now particularly the development of infection, it has certain stages, okay, or certain period we can tell. So first one is incubation period, next one is prodromal period, then acute period. Now, what is incubation period? In incubation period means it is a period between exposure to the infection and appearance of the signs and symptoms. Okay, so it is a period between exposure to infection and appearance of signs and symptoms. For example, you may be infected or affected by a microorganism. It will take some time to develop signs and symptoms. So that is referred as incubation period. Then next one is prodromal period. Prodromal period means it is a time period during which individual is experiencing the signs and symptoms. Okay, so that is referred as prodromal period. Next is acute period. Acute period means here the infection is fully developed. Here also the patient is experiencing signs and symptoms. Okay, so this is a developmental stage of infection. First one is incubation period, prodromal period and acute period. Please note this topic infection can be asked for 2 marks. Especially nosocomial infection is asked for 2 marks, or they can ask mode of transmission of infection, all this is asked for 2 marks. And you have already studied this topic in microbiology. So next is moving on to this continuation of development of infection. So first of already I have told, whenever there is infection, what happens is pathogen enters inside the body and that will result in signs and symptoms. Now what are the stages of signs and symptoms? Initially you will be having local sign. Okay, initially there is local sign, later what will happen, that there will be systemic signs. Okay, so initially when there is local signs, usually the patient will experience some necrosis of the tissue, or they can have lymphadenopathy where there is enlargement of the lymph nodes, or if respiratory system is affected, it can result in respiratory signs and symptoms. Patient can also have exudates where there will be pus formation or inflammation may be there. So these are the local signs that can happen in the body. Other than that, some other symptoms are there of infection, that is systemic signs. For example, the patient may experience fever, fatigue or weakness, headache, nausea or vomiting. All that also patient can experience whenever they are having infection within their body. Next is generalized stages of infection. In generalized stages of infection, it means how the pathogen is entering inside the body and how it will result in infection. It is similar to that of development of infection. Okay, just now I have mentioned about development also. So similarly, we have got stages of infection. So first stage is entry of pathogen. Okay, so first stage, what happens? The pathogen will enter inside the body. So there are different ways of entry of pathogens. It can be through blood, it can be through sinuses, or it can be through your droplet infection, isn't it? So that is a different way of entry of pathogen. Through any route, pathogen can enter inside your body. Next one is colonization. Now once the pathogen has entered inside the body, what will happen? That particular pathogen will multiply or divide. Okay, and that is referred as colonization. Next, what happens is incubation period. This already I have told. Incubation period means it is a period between exposure to infection and appearance of signs and symptoms. Next stage is prodromal symptoms. Prodromal symptoms means it is the period in which individual is experiencing the signs and symptoms. Next period is invasive period. Invasive period means here the signs and symptoms are becoming very severe. For example, the patient may experience fever, there may be swelling and inflammation, they can have tissue damage, and infection can also spread to other organs or other sites. So that is particularly regarding the stages of infection. Okay. So stages of infection is entry of pathogens, then multiplication of pathogens, incubation period, prodromal stage where symptoms will appear, and severe symptoms is occurring, that is invasive period. Next is modes of transmission. Now modes of transmission is also discussed, I think, in microbiology in the first year. So modes of transmission, we have got direct way of transmission and indirect way of transmission. Direct way of transmission means pathogen is directly entering inside the body. Okay. For example, through skin contact maybe. Indirect transmission means here the pathogen is transferred through contaminated object or contaminated environment. So that can be referred as indirect way of transmission. Maybe for example, through your flies or mosquitoes and all. That can be referred as indirect way. Okay, or inanimate objects are transferring the infection, that also can be referred as indirect transmission. Okay, so modes of transmission is direct transmission, indirect transmission. Direct transmission means pathogen is transferred directly, maybe through skin contact and all. Indirect transmission means here pathogen is transferred through contaminated object, environment, or even through your inanimate object. Now under direct, we have got through direct contact, that is maybe through skin. Next we have got is droplet infection. Droplet infection could be residual of droplets, that is through respiratory route. Okay, so infected person is coughing or sneezing, what will happen? the droplets will be present in the air, so that a normal person is maybe inhaling, then they can get infection. Next is contact with soil. Maybe you are walking with bare feet and all. That time what happens is chances are there that infection can spread through contact with the soil. Next is inoculation through skin or even through mucous membrane. And next way of direct transmission is transplacental, that is through the placental route from the mother to the fetus. Next one is indirect transmission. Now under indirect transmission we have got different ways of transmission. First one is vehicle borne. Vehicle borne means maybe through food, clothes, bedding or even through utensils. Okay, so that will serve as vehicle transmission. Next one is vector transmission. Vector means usually your ticks, fleas or mosquitoes, they will act as a source of infection. Next one is airborne. This already I have told, through droplet or through the dust. Next one is fomite. Fomite means inanimate objects get contaminated by this infected individual. So that is referred as fomite. Or sometimes it can also be transmitted through unclean hands and fingers. Next one is types of infection or classification of infection. So first one is primary infection. Primary means, remember, it is always first or initial infection is referred as primary infection. So first, whenever you are getting infected from any organism at first time, that is referred as primary infection. Next one is reinfection. Now reinfection means it is subsequent infection by the organism after the recovery. Suppose you have recovered and after that you are getting an infection again. That is referred as reinfection. Okay. Already you were having infection, you were cured, but even after the recovery when you get the infection, that is referred as reinfection. Next one is superinfection. Superinfection means it is an infection by the same organism. Again and again you are getting infected by the same organism. Okay, so that is referred as superinfection. Now difference between superinfection and reinfection is reinfection is happening after the recovery. Okay, but superinfection means before the recovery itself you are getting infected with the same organism. Next one is secondary infection. Secondary infection means when the host, or for example your man, his immunity will be lowered. Okay, so because of that what will happen, he may get infected with some other organism. Okay, so what happens here, when a host whose resistance is lowered by a pre-existing infection, a new organism is entering. Okay, that is referred as secondary infection. Okay, here infection is there already in the patient, but some other organism is also entering and is resulting infection. Next one is cross infection. Now cross infection means when a patient is suffering with the disease and new infection is happening from any other external source, that is referred as cross infection. For example, patient is admitted in the hospital, maybe for some disease condition, and he is developing certain other infection, that is referred as cross infection. Next most important one is nosocomial infection. This is usually asked for 2 marks or 5 marks. Now nosocomial infection is also called as hospital acquired infection. Okay. Now nosocomial infection or hospital acquired infections are acquired. Acquired means you are getting it as a result of exposure to microorganism in the hospital setting. Nosocomial infections we will only get because of staying in the hospital. Okay, that is within 24 hours of hospitalization, if you get any infection, that is called as nosocomial infection. Okay, so within 72 hours you will be usually getting the infection after the admission, that is called as nosocomial infection, and after the discharge within 30 days if you get any infection, that also can be referred as hospital acquired infection or nosocomial infection. Now nosocomial infection is a type of a cross infection. Okay, and most of the time it can be caused by bacteria like E. coli, staphylococcus or streptococcus. All these are the responsible organisms for nosocomial infection. and most of the time microorganisms are mostly transmitted by the healthcare workers, and it increases the cost of healthcare. Whenever a patient will get nosocomial infection, the cost of healthcare also goes on increasing. And most of the time what happens is the older adults who are admitted in the hospital, they are more susceptible to get this nosocomial infection, mainly because of their immunity is low, or maybe because they have chronic illness, or because of the aging process. What will happen is their normal mechanism will not be there, especially your skin mucosa, normal peristaltic movement. All this in turn can result in nosocomial infection. Then types of nosocomial infection, it is not there in the slide, please note that. So types of nosocomial infection is, we have got exogenous infection and endogenous infection. Exogenous infection means it occurs from microorganism external to the individual that do not exist as normal flora. Okay, so exogenous infection means it occurs from microorganism external to the individual that is not present as a normal flora. Endogenous infection is, it occurs when some of the patient's flora become altered and an overgrowth is occurring. Okay, again I'll repeat, endogenous infection means it occurs when some of the patient's flora gets altered and an overgrowth is happening. So that is referred as your endogenous infection. So this is about your nosocomial infection. Now next is infection prevention and control. So this topic is also important. How to control the infection or how to prevent the infection. So I have got so many points here. Whenever this topic comes, you will have to mention about each of these headings. I'll just recollect the headings. First of all, you have to mention about this OSHA. OSHA means Occupational Safety and Health Administration. Okay, so this OSHA is actually an agency. It has given some guidelines. Okay, so that will be the first point. Then secondly, you have to explain about universal precautions or standard safety precautions. Okay, that also will come under infection control. Separate for exam, it is seen that they asked standard safety precaution or universal precautions for 5 marks. Suppose this is asked, universal precautions is asked or standard safety precaution is asked, you have to explain all these things which comes after this. Okay. Then next point that comes is, under standard safety precautions, we have got hand washing or hand hygiene. We have got personal protective equipments, okay, like gowns, cap, gloves, boots and mask. Then we have got linen, use of clean linen. Then we have got patient transport. Then preventing needle stick injury. All this has to be explained in detail. Then next one that comes is vaccination or immunization programs. Then proper safe disposal, that is biomedical waste management. Then sterilization, then disinfection and cleaning, and then isolation. So these many points have to be explained whenever you are writing about infection prevention and control, or even about universal precautions or standard safety precautions. Everything has to be explained. The answer is the same here. Okay. So we will see what is infection control. So the Occupational Safety and Health Administration, that is an agency, it has given certain things. Okay, certain guidelines are given by this OSHA in order to protect the individuals. Okay, it will protect not only the patients but also it protects the workers. So that is an agency, OSHA. Okay, so OSHA has given this universal precautions or standard safety precautions. So under standard safety precautions, as I have already told, all this will come, okay, in detail. I am explaining it in detail now. Why we have to follow universal precautions or why we have to follow standard safety precautions? One main thing is, majority of the patients who are infected with HIV or hepatitis, they are usually asymptomatic, isn't it? So what happens is you may come in contact with any patient. You don't know whether the patient is with HIV or hepatitis. So most of the time what we have to do is we have to maintain standard safety precautions or universal precautions in order to protect ourselves. Okay, so universal precautions will protect the healthcare worker. Secondly, it will also protect the patients. It will prevent the spread of infection. Then it will protect the clothing of the healthcare worker. Then it inspires the person to use personal protective equipments, that is PPE. Okay, so why we are using PPE, that is personal protective equipments? One is to prevent the spill of your blood and body fluids. Okay, so these are the main aims why you are using the standard safety precaution. Now, if you ask me what do you mean by PPE, PPE full form is personal protective equipment. Under personal protective equipment comes your gown. Okay, then comes mask, then goggles or eyewear, hair cap, apron, you can wear apron also, a gown comes usually, gloving, that is gloves, then boots and shoe cover. All this is referred as personal protective equipment or PPE. Next is gloves. Now, gloves is also coming under PPE. When you are supposed to wear gloves, now all of you are aware, most of the time gloves are worn whenever you are doing any procedure, isn't it? You think that you are coming in contact with blood or body fluids, you have to put the gloves. Okay, so you feel you are going to come in contact with secretions, you can put on the clean gloves. But when you are doing a sterile procedure, see that you are putting your surgical gloves. I know that gloving procedure is already over last year. Okay, so next is regarding putting mask, eye protection and face shield. Now why you are putting your mask or eye protection is to protect your eyes, nose as well as your mouth. Most of the time what happens is when you are assisting any procedures or when you are performing any procedures, chances are there that the splashes of blood or body fluids may come inside your eye or it may come in contact with your skin. So to prevent that, you have to use goggles and even your mask. Now why you are using mask? In order to have respiratory protection, isn't it? Whenever you feel that you are going to come in close contact with the patient, that is 3 feet of contact, in that case you must wear a mask. And especially when you are working in the hospital, you are suspecting that the patient is having tuberculosis or any other respiratory infection, in that case you have to use a mask. Next is regarding gowning. Now, when do you put gowns? Again, when you are assisting for surgery or when you feel that your dress can be contaminated, there can be soiling of your clothing. In that case, you have to use a gown. Now, in the surgeries, whenever you are working as a scrub nurse, you may put the sterile gown. Okay. So always remember that whenever your gown is soiled, immediately you have to change your gown. Okay. So don't put the same gown and walk wherever you want. Next is regarding linen. Now the importance here is you should never mix soiled linen and clean linen. Whenever you are handling your clean linen or transporting the clean linen, see that you are transporting it in a well way so that it is not getting contaminated. And even when you are discarding your linen, see that soiled linen will go in soiled bin and the clean linen which is not having any soiled items, maybe like stool or urine, that has to be discarded in other bin so that cleaning will be easier in the laundry. Next is regarding patient transport. Now most of the time you have to limit the movement of the patient from one place to another, especially like transporting them for x-rays, ultrasound and all. Nowadays we have got portable x-ray machines, ultrasounds and all. So most of the time we will restrict to the movement of the patient. Why we are restricting the movement of the patient is one, chances of accidents can happen, and one more is chances of droplet infection may happen. So we have to limit the movement of the patient. Next is the most important topic, that is regarding preventing needle stick injury. Now needle stick injury happens whenever you are trying to recap your needles. For example, you have given an IM injection or intravenous injection And after giving that injection, some people have the habit of recapping the needle after using. Okay, so that time chances are there that you will get the injury, okay, from the sharp object. So most of the time it is our first foremost preference to prevent this needle stick injury. So to prevent needle stick injury, what you have to do, should not recap the needles what you have used. Immediately once you have pricked the patient, you have to discard that needle in the puncture resistant containers. There is a white can actually in the hospitals, so in that you have to discard the needles. Don't go to recap. Now, if at all someone tells you to recap the needle, okay, if someone tells you to recap the needle, you should use one hand approach. Now, what do you mean by one hand approach? One hand approach means you are using only one hand. You are not using both the hands for recapping the needles. Now, you can see here in the figure, see, cap is there with only one hand they are closing it. Okay, so this also will prevent needle stick injury. Okay, so now most of the time whenever you are suspecting that there is needle stick injury, what you will do, first you have to wash your wound for at least 10 minutes with soap and water. Always remember, whenever you are having any needle stick injury, wash your region wherever you have got injury for 10 minutes with soap and water. Do not squeeze excess of blood from the wound. Okay, then what you have to do, immediately you should inform the in charge or the doctor who is available there, because you should know whether the patient is having HIV or hepatitis B. Now, suppose there is splashing of blood or any other body fluids inside your eye. If there is splashing of the body fluids inside your eye, similarly you should wash with water. Okay, lot of water you have to use and clean your eye. Splashing the water with clean water you have to clean for at least 5 to 10 minutes. Then if at all the person is told that person is having any HIV and all, in that case you will have to take post exposure prophylaxis. Post exposure prophylaxis means you are taking the treatment after getting needle stick injury. So most of the time for post-exposure prophylaxis, you are giving some drugs, okay, like 3 drugs you can give or 2 drugs combination you can give. You will study it in detail in this year only. We have got one unit immunology where you are studying HIV in detail. You will study in that, but just I will tell for your information. Commonly you will give drugs like zidovudin, lamivudin and indinavir. Okay, so these drugs are given for treatment of post prophylaxis. Zidovudin we will usually give 200 mg 3 times a day. Lamivudin we will give 150 mg 2 times a day. And if you are planning to give indinavir, you are giving 800 mg or 700 mg 3 times a day. Next, some other ways of preventing infection, that is maintaining proper sanitation. For proper sanitation, what you should have? You should have good water supply. Okay, clean drinking water should be available, and whatever infected waste is there, it has to be disposed properly by biomedical waste management. That I am not going to take again. Biomedical waste management is over last year. So see that you are discarding all the items according to the color bins. Then whenever you are handling storage, package or even food items, you have to be very careful. And next is regarding vaccination. Now, already what happens is healthcare workers will receive frequent immunization. Now, you also, when you have come to this profession, you have received TT as well as you have received hepatitis dose. So, similarly, it is very essential that healthcare workers will take the immunization regularly, whether it is for prevention of your measles, mumps, rubella, chickenpox, polio, diphtheria, pertussis and tetanus. Next, this I have already told, proper waste disposal or biomedical waste management, that you have to study from last year's topic. Next is regarding sterilization. So this also is coming under universal precaution. It is a process intended to kill all the microorganisms. Okay, sterilization means it is a process that is used to kill the microorganisms. We have got different methods of sterilization like autoclave, dry heat, chemical sterilants like glutaraldehyde or formaldehyde, and using radiation. This is also sterilization portion we have studied in foundations. I am not taking it in detail. Next is regarding disinfection and cleaning. Now disinfection and cleaning is also very essential in order to prevent this occurrence of infection. Now most of the time, other than disinfection and cleaning, we also have to go for isolation. Now isolation here means it is a method used to prevent this infected patients from coming in contact with the others. Okay, so infected patients may infect others. So what we will do, we will keep them in isolation in separate wards or in separate places. Now which type of patients need isolation? Most of the time who are having this tuberculosis, those who have chicken pox, measles, mumps, or those who are having this low immunity, especially HIV patients or cancer patients or patients who are taking this treatment, cancer treatment like chemotherapy, these patients and all, you have to place them in isolation. Okay, why? Because most of the time they can get infected easily. Okay, other than that, even patients with infectious conditions like rabies or any other infected communicable conditions, they will also have to be placed in isolation wards. Next is, what is the role of infection control nurse? Now infection control nurse, her responsibility will be to prevent the occurrence of infection in the hospital. She has to see which are the wards with high risk. Then she has to monitor or perform surveys if at all patients have got cross infection, nosocomial infection, all this has to be assessed. Then she has to register the cases. I told no, they'll go to each ward, they have to find out which patient got nosocomial infection and they have to register the cases. Then they have to collect the samples and they have to send them to the laboratory. If at all they are infected with nosocomial infection, they have to collect their samples and send. Then they have to continuously monitor and supervise the staffs, whether they are using aseptic technique or whether they are using the personal protective equipment or whether they are using proper biomedical waste management. All this is assessed by the infection control nurse. Okay, so this is particularly about infection control and prevention.